So what we're going to do for you today is the medical microdermabrasion. After having a look at your skin under the Skin Observe, we noticed that you've got a little kind of bumpiness or congestion underneath the skin that you're feeling, not really on top of the skin, so you've not got active acne or anything, it's just under skin congestion. So what the microdermabrasion does, it's medical grade, we've got a sterile tip that we've applied on top of the machine, which I'll show you. It's going to fire out little crystals onto the skin, so you'll feel a little element of scratchy feeling, and I can test it just a little bit on the back of your hand before we start, just so you understand the feeling of it. It's comfortable, but you will feel like something's going on. The machine actually has a little bit of a suction on it, so you will feel like the skin is sucking up a little bit, but that's quite normal, that's what we want to do. You'll have a little bit of redness after the treatment, but that's great. All right, that's what we want to see. So a little bit of scratchy feeling, a little bit of suction going on, but that's all good things we want to see and feel happening on the skin because we know it's working correctly. So what we're going to do is double cleanse the skin to start with. We then pop some eye shields on the eyes just to protect the eyes. We'll prepare the skin with a skin prep just so it's fully prepared before. It smells a little bit smelly, but it just removes any oil or any excess dirt that the cleanser's not been able to lift off. And then we will work 2 passes over the skin with the microdermabrasion. We'll see how you respond. Sometimes we can come back on over problem areas where you said you've got the congestion. We can maybe go over a second or third time, or if there's any blocked pores or blackheads. This is really what it's good for, to really remove that congestion for you. Remove the crystals off the skin. You may feel them in your ears and in your hair tonight a little bit because they're kind of tiny little particles that go everywhere. It's just the diamonds, the crystals that are in the actual medical microdermabrasion machine. And they're actually made from aluminium oxide, but they're great for the exfoliation part of the treatment. So we'll remove those crystals off, and then we'll apply an enriched firming mask to really hydrate, nourish, and most importantly, calm the skin down and reduce any inflammation. We're just going to prepare the skin before the treatment to make sure everything's removed, and then the microdermabrasion will work a lot better. You okay?
Yeah.
So if you need to breathe, you can just breathe out of the mouth rather than in through the nose.
Yeah. Sounds like no.
No polish, it does. Everybody says that. It's just got an ounce of ethanol in there, and that's why you can smell that smelly smell. But it works beautifully before any medical procedure. Okay, you okay? Brilliant. So I'm just looking at your skin a little bit. Okay, so now we're going to put your eye shields on just to protect the eyes for you. So as long as you keep the eyes closed, it'll be perfectly fine. If it feels too uncomfortable, please let me know, but you won't even feel that they're on. So before we start, I'm going to test the microdermabrasion on the back of the hand. Because it's your first time, you will then understand how it feels. Yeah. Obviously on the face it may be a little bit more sensitive, especially jawline, under the eyes, but it should be absolutely fine. You all right? So this is the handpiece itself. We select a completely brand new, clean, sterile tip for our medical microdermabrasion. And in this machine you have the crystals flowing in one end, which is the clean crystals. It then is recycled out and the dirty crystals are taken out along with the dead skin and debris of the skin that we're removing. So it's a fantastic treatment, medical grade, and really does work well for any skin type, really. Okay. You're going to feel this. So a little bit of suction. And little crystals. Can you feel that little scratchy feeling?
Yeah.
So you will feel that on the skin, and we'll do 2 passes. We'll see how you respond. And then if you respond okay, we'll carry out another pass on the problem areas. All right? Okay. So we'll start with this side of the face. If you just turn that way as much as you can for me. A little bit to me, that's great. Are you okay there? Okay, great. So the first pass. And we can just see those little crystals on the skin there, which is fantastic. That's what we want to see. How are you feeling? Yeah? That's great. So that scratchy feeling is just those sapphire crystals that are being sandblasted over the skin to get rid of those dead skin cells. So you'll get a nice even redness on the skin, and that's what we want to see. On the nose, this is great for any blackheads. It really helps suck them out. And just really does a deep cleanse for that nose area. So not really suitable if you've got a lot of veins on the nose or the cheekbones. We would do an alternative treatment such as a skin peel or a photofacial laser treatment. Or if they're very thin skin, sensitive skin. But any other skin type, so mild acne, breakouts, just dull, thick, leathery, sun-damaged skin, and you just want to remove that dead layer and just give yourself a nice glow, this is great. And again, we say a course of treatments is best, but you can have a one-off treatment for maintenance also. And a minimum of 6 sessions once every 2 weeks is great. No need for a test patch. You can literally have on the same day as your consultation if you have the time. It's lovely. I just saw a blackhead come out there, which is really good. It's quite satisfying for us as practitioners because we know we're getting all that gunk out of the skin. And it can just be a build-up of every day. Makeup, the environment, pollution, products that we're putting on the skin that we think is doing a good job and actually it's just blocking your skin. And the same with makeup. Got a little bit of dead skin peeling there. There could have been a spot there or something before, but that will subside off. It's just come away from the vacuum of the treatment. And again, I'm just going to focus on that congestion that you've got there, just to really help that area for you. With congestion, and I'm talking about blackheads or blockages, daily use of creams, if they have ingredients that you shouldn't really be using on the skin and you're unaware of it, or it can actually be makeup. So everyday over-the-counter makeup or from the department stores, it really isn't that great for the skin because it blocks it up. There could be talc, preservatives, dyes in them, and it's just irritating to the skin. And the same with a lot of products because they're chemical based and they have a lot of unhealthy ingredients, as to say. It just causes congestion and blockages or blackheads, particularly in the chin, the nose, here, or if you're using a lot of blusher, you can get it on the cheekbone. So this treatment is great to really remove that. Also, if patients have got mild acne, if they've got the mild breakouts here or there, and it's leaving a little mark on the skin, this is really great because it does actually help reduce scarring. So I'm just going to turn the machine off there. How are you feeling?
I actually really liked it.
Yeah, you feel like something's working, can't you, and something's going on, and it feels a little bit scratchy, but is it quite comfortable?
Yeah.
Good. So we'll remove the crystals off, and then what we'll do is apply a mask for you, and that will just, again, it's very anti-inflammatory, it's really soothing, really calming, and our aim is to make sure everybody's calm and cool before they leave. They're not going out like a red tomato. And if you like, I can colour match you without makeup, so for you colour science will be great. We do have an alternative which is called Gel, and the reason why we chose these makeups was because they do not block the skin, they allow the skin to breathe, it's covering but it's protecting the skin at the same time. So you've got the SPF in there protecting from UVA and UVB factors. They're waterproof, so you can swim, you can sit in the jacuzzi with them, but they give great coverage. So if you want to cover spots, broken veins, you just want a nice makeup to use every day that's protecting and healing the skin, this is perfect. And actually the Gel, if you was an acne patient, so I'm talking about lots of breakouts and scars, the Gel aids and speeds the recovery of healing the skin. So it's great, and it works so well together with our treatment. So you will feel a few crystals later on tonight, but just obviously avoid any kind of heat treatments, any type of exfoliation for the next few days. No waxing or hair removal or depilatories or anything like that on the skin, because obviously it's going to be a little bit sensitive because we've just removed an element of dead skin. Obviously the more sessions we have, the easier and the better it will be to remove this congestion. One is great because we've just removed that top dead layer, but we may need to just keep going a few sessions to really get deeper down to reduce those little bumps underneath your skin for you. So no sitting out in the sun directly. Obviously you want to wear SPF every day just to protect the skin, especially after having a procedure like this. And we've got some great medical grade makeup, like I said, that has the SPF in there to protect the skin. All right, so now I'm going to apply your mask. This is quite cold because we keep it in the medical fridge, but the aim of this is just to calm and suppress any of that redness, but it's going down already, it's great. It's a bit cold. You okay?
Yeah.
I mean, you've got beautiful skin, just a little bit of congestion. You've got plump, nice young skin, So this treatment is great for you. It's just going to keep your skin plump, it's going to keep the skin looking young and fresh, but just really target that congestion that you've got, so it's perfect for you. How's the mask feeling?
Really nice.
Is it good? Yeah. Worth the wait. Put a little bit on the lips because it's nice and hydrating there. Sometimes we've got chapped lips, this really works quite nicely for that. Lovely, and we'll leave that for 10 minutes and then we can remove it off. Apply some post-treatment product, and that's the medical microdermabrasion.